Welcome back. Now that you're familiar with your cheat sheet and how to deliver an awesome presentation, it's time to enter the room and talk to your patient. Are you ready? In this module, you'll learn how to be quick and effective and avoid the common mistakes that candidates fall into in the subjective assessment, which led some to fail. This is it. You've done a good presentation, you ticked so many boxes already. You just need to grab your cheat sheet and follow what it says. Remember, there's not much room for improvising. It's all written there. Past you, the calmer and rational you, already gave you all you need to say in that magical piece of paper in front of you. Every time you feel the stress rising, just take a deep breath and look at the paper. It will tell you exactly what to do. It's your best friend and it will save you any time. The solution is in front of you. Just use it, please. You leave the presentation room with the examiners. You grab the tools you need from the equipment room, use the hand sanitizer and knock on the door. It's showtime. It's time for your intro. You say, "Hi, my name is Carmelo and I'll be your physiotherapist today. These are the examiners and they will watch over our session. Is that okay with you? So I've read your file and I'd like to ask you some more questions about your shoulder. Then we'll do a practical assessment to understand what you can do and what I can help you with. Is that okay? Also, if there's anything you want to ask me or if you are uncomfortable or in pain, just let me know, okay? That's it. The main focus is on consent, so make sure you wait for a positive answer at the end of each of those questions. Now you'll talk about the main concern or injury. Ideally, you want to direct the conversation in the order of the cheat sheet. However, you might have to use an open question to start with, especially if the information from the file was very little. If you have a small file, you will start with, I read you had issues with your shoulder. What happened? And then redirect them into the walk-snore and FATMA script as soon as you can. If you have a big file, you lead with more closed questions through the interview, confirming the information you already know, as it will save you time. You'll start like this. So you had your knee replacement 5 days ago. How's the pain? In both cases, but especially in a short file scenario, the conversation can go through a completely different order within the items of the cheat sheet. And that's fine. Just try to keep it logical and grouped by topic. So if you're talking about pain, try to clear as much of the walk-snore as you can at the same time. You can follow the flow of information that comes naturally out of your patient, but always look back at the cheat sheet to remind you where you're at. You want to go through the entire subjective section of your cheat sheet as fast as you can, but also listening to the answers as you'll need to address them during the assessment. I personally don't write anything during the interview because I'm a slow writer. However, you can write down the 0 to 10 pain scale or other details if you think you'll forget them. Clear the red flags and then it's time for past, med, house, work, social. Go back to module 2 for more details about what to say. When inquiring about medical history, I usually ask, any other heart or lung condition, diabetes, surgeries? Closed-end questions are always quicker. The interview ends with short and long-term goals. Make sure you use the terms short-term and long-term and goals when you talk to your patient to leave no doubt that you're really addressing them. It's fundamental to keep the subjective assessment short. When you train, I'll ask you to keep it down to 8 minutes or less so that in the exam you can aim at finishing it under 10. To achieve this goal, you need to talk fast again, but also manage your patient's answers. In some cases, your patient will talk a lot about their issue, or slowly, or talk about completely different topics. Your aim is to keep the conversation focused on your priorities and the assessment priorities. If the conversation is going too slow, you can use sentences like, I'll ask you more about that later, and then pass to the next item. If the patient is too talkative, you can cut them off saying, all right, so what about, or while you're on this topic, tell me more about, interrupting the patient is not a good thing to do with a real patient, and it might not look great during the exam either. Therefore, use your body language to make it seem as you're genuinely interested about the following part of the conversation, instead of really wanted the patient to cut it off. Lean towards the patient, not visibly with your head. Lift your eyebrows, smile, and leave your mouth open when you're ready to interrupt, so that the examiners and the patient can see that you're ready to follow the conversation along, instead of abruptly direct where you want it to go, just out of nowhere. You cannot allow the interview to go over time. So if you fail to complete it within 10 minutes with these methods, you'll have to shorten the interview. To shorten the interview, just ask about fewer items, but at least one from each category. You might skip nature and radiation from Woxnor, transfer and toilet from FatMed, and ask about only half of the red flags. Cut it short and go to discuss the goals, which you must ask about, so you cannot skip the goals. This is not an ideal situation, but it will contain the damage to maximum one performance indicator, instead of ruining your whole exam. Remember, you won't fail if you miss a question in the subjective, but you definitely can fail if you miss something in the objective assessment. Plus, if you've done a perfect presentation, you might have already ticked that first performance indicator anyway. Think about what the aim of the subjective assessment is. The aim is to get to know the patient, understand about their life and their situation, create an alliance to achieve what they want safely. So get a general idea, exclude red flags, and talk about what they want to achieve and why. The secret for a perfect subjective assessment is goals. Everything revolves around goals and the frequently used concepts you wrote at the end. In the domains and performance indicators list, for example, there's no mention of pain level, no mention of night sweats, no mention of toileting, no mention of radiating symptoms. Even though these details can be important from a clinical point of view, you must not get bogged into this minutiae. You just need to demonstrate that you know how to conduct a good interview. So try to mention everything you wrote on the cheat sheet, but keep in mind that the most valuable section comes at the end. Let's summarize what I want you to do at the end of the interview. Ask for short-term goals. What would you like to achieve from today's session? If they've already expressed the desire during the interview, summarize it like this, for example. So you mentioned that you'd really like to improve your movement. So we could set this as a goal for today. Does it sound okay? Ask for long-term goals. What would you like to achieve in the long term? If they've already expressed their desire during the interview, summarize it like this, for example. So you mentioned that you really like to go back playing golf. So we could set this as a long-term goal. Does it sound okay? In both cases, you must say the words short-term goal and long-term goal. Talk about what the GP or surgeon has recommended or is expecting to achieve thanks to the physiotherapy intervention. These sentences will motivate the patient, as it brings the doctor's authority on the table, and it looks at the issue from a team effort perspective. Break down the goals into achievable, practical actions that will be your priority for the day. You might have already established that in your mind, but remember to mention the word priority. This will also make your work easier when it's time to assess and implement your intervention, as the patient will have already agreed and understood that what you'll do is part of the plan to achieve their goal. So to play golf again, we could get your shoulder to lift and swing a bit more. What do you think? If you had concerns about safety during the presentation, you can confirm or negate them now in light of the findings from the interview. You can also mention additional concerns that might have arisen from the interview itself. If you have no safety concerns, just say, we always want to be safe, so please let me know if you feel uncomfortable at any time from now on, okay? You might have mentioned the words influencing factors already, and it's all fine. If you haven't, make sure you do, linking them back either to goals, priorities, or safety. Confirm or negate the factors you identified in the presentation, mention any possible new one that has risen from the interview, and just explain that they might interfere with the quality of their improvement or the speed of their recovery. Influencing factors might be from the current history, like pain, from the past history, like heart or lung disease, or from the environment, like house settings. Finally, mention areas outside your expertise and refer to the appropriate professional. It looks like a lot, but with practice, you'll be able to go through this last section in just a minute or two. You might find your own way to condense everything in just a few sentences, but please still remember to actually say the words. I know that you already mentioned all these concepts in the presentation, but I'm here to provide you with the tools to give an astonishing, bulletproof performance. So follow my advice. This is the most important part of the interview, so it's fundamental not to overlook it. You'll make the job easy for the examiners to give you full marks, and you'll save yourself if you accidentally forgot anything during the presentation. And here it comes, another moment to finally yell, pause! You've done most of the work. Good job. Just take the time now to look at the cheat sheet and make sure you've asked everything you wanted to ask. Whether you're in a hurry for time or not, you have to pause and quickly use the additional words you wrote at the end of the subjective section in the cheat sheet, just like you did in the presentation. Share with your patient the doctor's goals, the factors that might be influencing their recovery, and your intention to establish treatment priorities with them to address both their goals and the doctor's goals. This is the end of the subjective module, so it's time for homework. I want you to practice your conversation alone and with friends and colleagues, in the car, at work, or at home, both mentally and aloud. Put yourself in different situations until it becomes very smooth and natural. Aim at completing the conversation in less than 8 minutes. You can use a patient's notes as reference or just a diagnosis. The latter is the easiest way to test your time, and as you will have to ask all the questions for all the single items of the cheat sheet. When you practice by yourself, briefly answer to your own questions as if you were the patient too, to give yourself a more realistic time frame. And always use the cheat sheet, as you need to train yourself at following the items and double checking that you haven't left anything behind. In this module, you learned how to take control of your interview and complete it in under 10 minutes. And you learned that the number one secret for your interview is, well, if you don't remember, go back and watch this lesson again.